today we'll be showing you the latest and greatest of what the team has developed, and we'll walk you through some scenarios. So I'm going to turn here to the agenda and talk you through an overview. Then we will go through the Calheers system demonstration, and at the end we'll take questions and answers, both written in and called in from those of you who are listening. I do want to mention that we are very eager to receive your input as well in writing after this demo. And at the very end of the presentation, there's a slide that shows the email address for which you can send written input to us up through next Tuesday, the 25th. We are also presenting at our June 20th board meeting a shorter version of this, but we'll be presenting a webinar at that board meeting on Calheers as well. So you'll see some of the same functionality presented then and have another opportunity for questions and answers. So with that, I'm turning to the overview slide, which is slide 3, and want to orient you to the population that we're talking about today. Today's focus is on the online self-enrolled functionality for Calheers. As you see here in the pie chart, we've got a number of different ways for people to access health insurance benefits through Covered California. And one of them is by working with certified enrollment counselors, which people can do online or on paper. Working with the service center, which would be online, or having the service center representative sign people up who cannot access Calheers online. And paper applications will also be accepted by Covered California for self-enrollment. So again, today, our channel that we're focusing on is the online channel for people who are self-enrolling. At this point, I'll turn over the discussion to Terry Shaw, who will walk you through the system demonstration. Hi, Terry.
Hey, thanks very much, Julie, and thank you to all of you on the call. I am going to be walking you through a demonstration of the Calheers system, as Julie mentioned. And for the purposes of this demonstration, I did want to note that we built this demonstration around a mixed household scenario for a family of 3. In this scenario, the mother is ultimately eligible for coverage through Covered California with a premium tax credit and cost-sharing reductions. The daughter is eligible for Medi-Cal, and the father is not applying because he already has coverage. So, of course, they don't know any of these results going in. The point is we're going to show you how the system will help them navigate through the application process and into coverage. You'll note as we go through that these, as Julie noted, these are these screens and the process flows that you're going to see are a work in process, and they are likely to change in the initial system rollout, so this is a point in time. But as we go through, I will note elements that are based on industry standard Enroll UX 2014 guidelines, and in some cases we've also drawn from other models such as the CMS draft application. And we also are in the process of doing some usability research and testing, and recommendations coming out of that testing will be incorporated as we go through. Okay, so turning to our next slide. We're going to go ahead and switch over to the demonstration at this point.
Terry, can you pause for a second? We are seeing some questions coming up around where are the slides, and the slides are posted on the Health Benefit Exchange website at this time, so you can access those there. However, the demonstration itself is interactive and is not part of those slides, but the slides that we are speaking from and projecting are posted. Okay, back to you.
Great. Did you want to mention also the webinar is being recorded?
Yes.
So that it will be visible at a later time as well if people want to come back and take a look at it later. Okay, so let's begin the demonstration. Here we are on the home page, and our user, her name is Pat Jones. arrives here on this page, and she sees that there are a variety of tools that are available. I first want to point out to you some tools that are available up in the header. First of all, there are some help tools. As Julie mentioned, there are a number of other pathways to enrollment, and many of those are actually integrated right here through the website that the people who visit the site can access. The customer service line through the phone number is readily accessible. There's online chat that's available. There's the ability to find help near you by searching for a local certified enrollment counselor. So many of those other channels are accessible through the website, or information about them is available through the website. Other tools that are available in the header, first of all, Pat could change the font size of the site if she wanted to. She could also toggle over to the Spanish language version of the site. And then there's also a globe icon there that has behind it information about information in the other threshold languages. Okay.
Let's take a pause here. We're getting some comments that we may not be sharing.
This is a copy of what you see.
All right. So, all right. We are being told that you should be able to see the screens that we're sharing on the webinar. Okay. Some folks are saying they're just now being able to see it. Okay, great. Great. Sorry to interrupt you, Terry.
No, that's quite all right. We want to make sure everybody's seeing the screen. Great. Okay. So other quick things up on the header, you can see that Pat also has the ability to log in or to create an account. But the main things I wanted to point out on the main body of the page are two. First, at the top here, you can see that there's a prominent call to action, which is a ready access for Pat to go straight into the application process if she's ready to do that. A little bit further down the page, you can see a set of options that allows Pat to self-identify her interests and quickly start down the appropriate path for her. As you can see, there are paths for individual or family, or employer or employee of a small business, or certified enrollment counselors. So all of those paths are readily available. In our case, Pat's here to get insurance for her family, so she clicks the button for individual or family. And when she does, she's taken to the individual and family homepage. On this page, she can get more information about the options for individuals and families, and there are some new elements on the page to help her learn more before getting started if she wants to do so. There's this bar across the top that has 4 different elements to it. The Learn element has a lot of educational material behind it. We're going to take a look at that in just a second. The Preview Plans element allows Pat to see what programs and plans may be available to her based on a quick set of screening questions. The Apply feature allows Pat to jump right into the application process. And then there's also this Maintain feature that only becomes active once the application and enrollment steps are complete. And that's where Pat can report changes or renew coverage after she's enrolled. But let's imagine that Pat wants to learn more before she begins her application. So she clicks on the Learn feature, and she's taken to a tutorials page that has a library of different video tutorials that explain how to do various activities through the site. Other pages that are featured here include frequently asked questions, pretty standard format there where she can choose on a question of interest, jump to it, jump back to the top when she's ready. There's also a glossary that's available with terms that are used on the site. And then you can see over on the left-hand side there are a variety of other features, about us, fact sheets, contact us, the search tool, etc. So once Pat has finished looking through the Learn Center, let's imagine that she returns to the individual and family homepage. And I want to point out that at this stage, Pat is not logged in. So at the header on the top, you can see that there's an invitation to log in or to create an account. But let's imagine that Pat previously visited the site and has already created an account. So, and then she paused to take care of something else. Now she's returned, and after looking through the Learn Center, she's ready to keep going, so she decides to log in. She decides to log into her account. does, you can see that she's now on a logged-in version of the homepage. Up in the header, it greets her, hello Pat, allows her access to her profile and the mailbox, etc. And there are also some additional resources that are available there on the right-hand side. But in this case, Pat is ready to apply, so she clicks right at the top there, the prominent Apply Now button. And when she does, she lands on an overview page. This page gives her a high-level sense of the entire end-to-end process, so she'll know what to expect. This is a concept that's drawn heavily from the Enroll UX 2014 model. So when she's ready, she clicks Continue. And she's taken to a consent page, and I want to point out some additional elements that are now on this page that help her understand where she is in the process and what else to expect. So you'll notice across the top there is a progress bar, and that tells about each of the sections that she'll be going through. It's highlighted on the Start feature, which is where she is now, and then on the left, underneath the Start label, you can see there are a number of steps within the Start sequence that she'll be going through. So in this case, she's on the consent page. She does need to agree. Once she does that, she can continue. And now she'll move to the primary contact page. So on this page, first of all, there's some information that's pre-populated here. And that is not just a feature of the demo, that is actually what we would expect to happen in actual implementation, because this information is pre-populated from the Create Account stage that she already went through. She does have the opportunity to update it as she wishes, but where we already have information, we've pre-populated it. Some other things to point out on this page that are common elements in the site. First of all, at the top of the page, there's an explanation of the required field indicator. So the little red asterisk. And that, of course, appears next to the relevant items. There's also an eye icon in the top right corner. And that's a page level help tool that explains the various elements on the page. In addition to that, there's also a field level help tool. As we scroll down, we'll see an example of this with the blue question mark icon there. And that gives more information about that specific element on the page so that Pat knows what's being asked and gives her some insight into how to answer it properly for herself. And then another feature down here at the bottom of the page is a Save and Exit button. This is a common element that allows Pat to stop at any time, save her progress and her information so that she can come back to it when she's ready. In this case, Pat is ready to move on to the next step, so she clicks Continue. And now she comes to a crucial fork in the road. This is a step where Pat needs to decide whether she wants to apply for help paying for coverage. Because that can be a tricky question, we have a tool there to help her decide how to do that. So let's click on Help Me Decide. And we'll see that she's asked about zip code, which will, again, be pre-populated because she's already provided that in her account stage, and primary contact information. And then a brief question about how many people are in her household. And we're going to use this information to structure the next question, which is a question that asks her if her income is below a certain amount. Now, this amount is dynamic. It's calculated at 420% of the federal poverty level for the household size that she entered on the previous page. In Pat's case, her income is less than $40,000 per year, so she answers yes to this question. And she gets a helpful message telling her that she is likely to be eligible. So she clicks OK from this page. And now on the Help with Costs page, she's inclined to answer yes and click Continue. And that will now send her down the single streamlined application for the Insurance Affordability Program. Okay. The next step that she comes to is the household section. Notice on our progress bar at the top that she's now finished the start section, so that's checked off, and the household section is highlighted. This introduction is based on a concept that came out of the Enroll UX 2014 model. We've also seen it in some of the CMS models. It gives Pat a sense of what to expect, what kinds of information documents she'll need to have on hand, and how much time she can expect to take. When she's ready, she clicks continue. And now she moves on to the household list step. In this step, she's asked to provide brief information about each person in her household. There are instructions on the page that are intended to help her decide who to include and who she can leave out. In this case, we have pre-populated, just for demonstration purposes, we've pre-populated the information to show 2 people have already been entered. In the real world scenario, the first row would have been pre-populated because that's Pat, and we already have information about her. But in this scenario, we're assuming that Pat has already entered information about her husband, Chris, and now she's going to enter information about her daughter, Jane. So she clicks Add Person. She enters some very basic information about her daughter, name, date of birth, and whether she wants to get health insurance, yes or no. When she's done with that, she clicks Add. The table is updated, and now she has included all of the people in her household. And she's ready to move on, so she clicks Continue. Okay. So based on the information that she just entered, the system is able to build out some of the remainder of the application. So we see here, for example, on this page, the menu items on the left have been expanded to include a tab for each person that she said was in her household. So that's an example of the dynamic nature of the application. It's tailored to meet the user's circumstances. Let's look at some other examples of that. Here on this page, we can see for Pat, she's asked her gender, and when she selects female, the application expands to ask if she's pregnant, and if she says yes, it expands to ask for more details about her pregnancy, all information that's used in calculating her eligibility. But in this case, Pat is not pregnant, so we would click no there. Another example of how the application is tailored is this Social Security number question. You can see here that Pat, we know, is applying for health insurance based on what she's already told us. So we have information here that explains that she needs to provide a Social Security number if she has one. But let's see what happens when we move on to her husband, Chris. Pat already told us, as you can see at the top there, that Chris does not want health insurance. And so the Social Security number question is worded a little differently for him, or the information around it is worded a little differently, to point out that the Social Security number is optional for him. So that's another example of how the application is tailored to the user's circumstances. Okay. So let's move on. Through Chris, she would also answer questions about Jane. And then we come to the relationship step. So in this step, Pat needs to provide information about how the members of her household are related to each other. We use this information along with other information to calculate her eligibility, her household size, her income amount. So when she's entered that information, she's able to continue. And then she comes to a summary page. This summary just provides a few of the pieces of information that she's entered so that she can verify that it's correct, edit it if necessary right there in line. But once she's ready, and she's comfortable that she's answered accurately, she can go ahead and continue on to the next step. So the next step, notice, is the applicant section. That's now highlighted on the progress bar at the top. The household section is complete. And the applicant section is where the system asks questions that only need to be asked of people who are looking for coverage. Note that there are now just 2 names on the left-hand menu, Pat and Jane. Because Chris is not applying, the system does not collect information about him in this section. So this is another example of how the application is tailored to the circumstances of the user. So again, we have another introduction here where she can learn about what's coming up in this section, documents that she may need to help her through it, an estimated time to complete. When she's ready, she can click continue and move on. So here on the left navigation, you see the name of each person that we'll be asking questions about. We have some more examples of some dynamic questions on this page. One is the set of questions around citizenship and immigration status. If Pat says that she is a citizen, she is asked about whether she is a naturalized citizen. This helps with the data verification process. If she indicates that she's not a citizen or national, then she's asked to indicate whether she has eligible immigration status, and when she does, she's asked for information about that status. In this case, Pat is a citizen. So let's continue down the page. You can see there are also questions here about other health coverage and healthcare needs, and there's a set of optional questions. This is another example of a dynamic question. If she indicates that she is Hispanic, Latino, or Spanish origin, then she's asked for additional detail about that ethnicity. Okay, so when she completes this page, she continues on and is asked similar questions about her daughter, Jane. And then she can continue to the applicant summary. This, again, is a summary of the information, key information that she's entered, so that she can be sure that it's correct, edit whatever she needs to, and then when she's comfortable, she can continue. The next section she comes to is the income section. Again, you can see on the progress bar that the income section is now highlighted. And the introduction here explains that we will be working through 4 different types of income. That's also indicated on the left-hand side. So she can see the steps that she'll be going through. She's also given information about the kinds of documents that she may need and estimated time to complete. So we're going to look through the 4 different types of income steps very briefly. The first step she comes to is the employment income. Pat is asked if anyone in her household has employment income. Because her husband, Chris, is employed, Pat clicks on Add Income, and she enters some basic information about Chris's employment, his employer, how often he gets paid, the amount he gets paid, etc. When she's done with that, the system automatically takes that information and calculates a monthly amount and adds that information into the table, and also updates the running total at the top of the page. When Pat is finished with the employment income, she clicks continue to move on to the next type of income. In this case, it's self-employment income. In Pat's case, she has no self-employment income, so there's really nothing that she needs to do here. As it says, if nobody has self-employment income, then she can just click continue, so she does. She's taken to the other income page. Now, in Pat's scenario, she does have other income. In this case, she has unemployment income. In the interest of time, we're not going to demonstrate that data entry for you now, but take a look at the total at the top there, and notice that as we click continue, that total is updated to reflect the other income, the unemployment income that Pat added on the prior screen. She actually does not have any income deductions, so she moves on, clicks continue off of this page. And then she's taken to an income summary page. Here on the summary page, she sees a summary of all the information that she entered, and she has an opportunity to edit it. She also sees the monthly total and the projected annual total income. And she has an opportunity to override that projected annual income if she expects her income will be different. But once she's comfortable with the income data, she can continue. Now the income section is complete, and she's done with entering the application data. She has a chance to review every answer she gave and change anything that she wants to change. And when she's done reviewing that information and is comfortable that it's accurate and complete, she can move on by clicking continue, where she's taken to the signature page. On this page, she has some options to consider about maintaining her verification over time. She needs to make some attestations. And she also needs to provide her e-signature and her e-signature PIN. This PIN is a number that she created when she created her account. So she'll have some messaging around that at the time that she creates the account. When she's ready, she clicks submit. And once her application is submitted, the system verifies key data electronically and calculates her eligibility in real time where possible. The results are displayed on a person-by-person basis with the ability to jump back and forth to each person's results. But let's take a closer look at Pat's results. It contains several key pieces of information. First, at the top here, we'll see that it identifies the programs that Pat is eligible for. In her case, she's eligible to purchase coverage through Covered California. She has access to the advanced premium tax credit, advanced payment of the premium tax credit, as well as the cost-sharing reduction. The next section describes key actions that she's required to take, in this case, choosing a health plan. We'll look at how that works in just a moment. Next, she's informed about any programs that she's been determined ineligible for, in her case, Medi-Cal. And she's also given a set of important information and options, including the basis for the decision, the ability to appeal, and the opportunity to forward her information for use in eligibility for programs like CalWorks and CalFresh. Let's look at Jane's results for a moment. Jane's result has similar elements to it. In this case, Pat sees that Jane is eligible for Medi-Cal and that she will receive information about how to select a health plan in the mail. This scenario is built around a January 13, 2013 application date. Online plan selection for Medi-Cal won't be available until later in the year, so this is how it is shown at this point in time. But in the important information and options section, you can see that Pat can view and print a Medi-Cal eligibility confirmation page. Let's take a look at that. This confirmation allows Pat to access services for Jane immediately while her permanent card is being mailed. So let's go back to the results. So after looking through all of this information, Pat sees that there's an action required for her, which is to choose a health plan. So she goes to that part of the page and clicks on that button. Okay. Now Pat is entering the enrollment portion of the process. You can see that's now highlighted in the progress bar at the top. The first thing she sees is an introduction of what to expect. And this introduction actually summarizes for her who in the household is eligible for which programs, with the ability to select plans for each program separately where available. Once Medi-Cal plan selection is available online, there will be another Choose Health Plan button in that row of the table. But for now, there's just the one Choose Health Plan button, which Pat clicks. And when she does, she's taken to an introduction to the plan selection process, where she can see an overview of what to expect. And then she moves to a page where she can indicate a couple of things that will help her compare health plans. First, she's given an opportunity to indicate how much health care she expects to need, both medical care and prescription drugs. The system uses this information to estimate the total annual cost for each plan. We'll see how that works in just a moment. In addition, on this page, Pat can tell us if there are particular doctors, hospitals, or other healthcare providers that matter to her in choosing a plan. So if she clicks Find a Doctor, she can search by name or by location. She'll see a list of potential matches. She can select the one that's of interest to her, view the details to make sure that's who she's actually interested in, and then add that provider to her list. She can do this as many times as she wants, providing as many preferred providers on her list as she likes. Now, these two questions about estimating costs and preferred providers, users can skip either or both of these questions if they choose. But we know from other research that cost and doctor preference along with coverage, which is shown on the next page, are generally the things that are most important to people when choosing a plan. So with those two simple questions, the system helps her choose higher value plans without asking detailed personal questions about her health or forcing her to do complex calculations. So let's take a look at how that information that she entered is used to help her shop for plans. So here on the plan comparison page, Pat can view and compare information about all of the plans that are available to her. The plans are arranged in columns. This is consistent with the Enroll UX 2014 model, and it's also supported by evidence that people choose higher value plans and plans that better meet their expressed needs when the plans are arranged in columns rather than rows. In Pat's case, there are 51 plan options that are available in her region. She can view all of those plans by using the pagination tools at the top of the page or by clicking on the left and right arrows to scroll among the different options. There are a number of other ways that Pat can change her view of these plans. She can filter plans by metal tier. She can also sort the plans by a variety of other criteria. Notice that one of the options here is a smart sort. That smart sort is the default sort, the sort that's used to first display the plans. And it's based on several factors. One factor is whether Pat's preferred providers are covered by the plan. Another factor is the total estimated annual cost of the plan. The system calculates this total for Pat. First, the system estimates Pat's annual out-of-pocket cost for each plan based on the amount of medical care and prescription drugs she said she was likely to need on the prior page. Then the system adds the out-of-pocket estimate to the plan's annual premium to get a total estimated annual cost for each plan. So you can see that Pat can see both the monthly premium prominently at the top of the column, as well as an estimated annual cost. The final factor in the smart sort is the plan's overall quality measure, which is indicated for each plan. Note that Pat can update her preferences at any point in time. She can do this by a couple of means. First of all, on the left-hand navigational element, the menu on the left, you can see there's the preferences page is listed there. She could click on that and go back to that page and update her information that way. She can also click on the Customize or Update tool under the estimated annual cost, and that would allow her to update just that portion. Similarly, under My Doctors, she could click on Search and update her preferred provider list. So a number of ways for her to update her information and see how that would change the results for the plan. A couple other features on this page to note. First of all, at the top here, you can see that Pat has the ability to mark plans as favorites using the little heart icon. And when she does that, she can pull up a comparison page that shows just those favorite plans side by side. She can also add a plan to her cart. And Pat can also scroll down to see other details about the plan, like cost-sharing rules for specific services, etc. When Pat has found a plan that she likes, she clicks on Checkout. And during checkout, she sees the plan she's chosen and its cost, and she has an opportunity to adjust the amount of premium tax credit that she wants to take in advance. So adjust monthly tax credit. Doing that pulls up a tool that helps her learn about the premium tax credit, some basic introduction to the tax credit. When she continues, she sees more details about her options to either take the tax credit in advance or to collect it during her annual tax filing. And when she's done looking at that, she can see a tool here, a slider, that allows her to confirm how much, if any, of the tax credit she wants to take in advance. So she can slide that back and forth to set it to the appropriate amount. And once she's chosen her amount, she clicks confirm, and she's taken back to checkout. When she's ready, she clicks on agree and sign, and again provides an e-signature, and there's information about enrollment. When she's ready, she clicks submit, and she is enrolled. She sees here an enrollment summary that tells her the plan that she selected. It also gives her an opportunity to make her first premium payment. That functionality is still under construction, so we won't show it right now, but that will be part of the implementation. Pat also has the option of not paying right away and coming back to do it later. If she decides to do that, she clicks done, and she'll see a reminder that she'll need to pay her premium. When she's ready to move on, and she's done with all health insurance related steps, she's given an opportunity to learn about other programs that may be of interest to her. And when she's finished looking at those, she clicks return to home, and she's taken back to the home page, this time in maintain mode, because she's successfully enrolled in coverage. So that concludes the demonstration. I'm going to turn it back over to Julie for the Q&A portion.
Great, thanks, Terry. And joining me here in the room is Len Finocchio from DHCS. As we're co-presenting on this, we're going to be taking questions and answers and distributing them as well to the team here as we're reading some questions that are coming in. So I want everybody to just kind of be aware that this was a fast track through the entire system demo. There were a number of questions about eligibility. There were also a number of questions coming in writing about the plan. And so before we move too far into the other questions, I wanted to address some questions about the plan. The demonstration here shows 51 plans, and as we all know, we've got 13 covered California health plan issuers that are contracting with us. So this is really a terminology distinction. The 13 covered California QHPs, as we have called them in the past, refer to the insurers with whom we're contracting. The 51 plans refer to specific plans at the bronze, silver, gold, and platinum levels. So there are a number of plans that are out there, and depending on what the filters are and the sorts are, we can come up with quite a number of plans for people to select from, which is why that scroll bar back and forth that Terry mentioned is very important, and also why the preferences that a person puts in, which are optional, but the preferences help also kind of sort for them what plans may be important to them. The plan descriptions, which we did not show in the demo, but if you can scroll back to one of those pages here, there is more detail about each plan that will be shown underneath. So we're showing now some of the columns where you can go, and if the consumer presses the buttons on any of those parameters, such as the deductions, out-of-pocket, need immediate attention, hospital stays, outpatient, etc., there is a wealth of information about each of those 51 plans that's showing for this consumer that can be shown. So there's a lot more that we weren't able to show in this demo. So enhanced silver would be the metal level. That is the cost sharing reduction plan. And Terry, anything to add to that?
One other feature to point out is you see there where the copay HMO is underlined, and similar features on other plans are underlined. There's the ability for the individual to access details about each specific plan in isolation as well. So they can either, as Julie pointed out, see the details on a comparison basis by opening up those expansion windows further down the page, and or they can pull up a detailed page just for a specific plan.
Great. Okay, thank you. And there is a question about quality ratings as well. Quality ratings will be shown when we open for enrollment. The open date for enrollment is still October 1st of this year, so there were some questions about that. When will it start? And
historical metrics from those issuers in the past, coming from the we don't have any, obviously, we don't have any specific quality data on these specific QHPs plans and these specific insurance plans, but as time goes by, we'll be able to gather quality data. So in the future, quality statistics can reflect the actual experience of that plan.
And when Medi-Cal plans are made available in 2014, their quality metrics will also be made available so you can compare and shop as well. There are a number of questions about the functionality of the application itself that we'll address now. Does the application stop if certain fields aren't completed? So can you go through the application and leave the blank fields and hit send, and what would happen?
So the application has a fairly industry standard required field indicator, and it's visible next to various questions throughout the application. When a person tries to click off of the page without having filled in one of those required fields, they see a message that highlights for them that that field has not yet been completed and that they need to complete it in order to move on. So that's how the required field elements are addressed.
So blind and then also languages.
Yeah. So with regard to access for the blind and other questions around accessibility and 508 compliance, so the system is designed to be fully 508 compliance and WCAG compliant. The system will be accessible through screen readers, industry standard screen readers for the blind. And what was the other? And
what languages?
Yeah, and with regard to there was a question about the drop down, the globe. That will show a drop down list box for the threshold languages, and when you select a threshold language from the drop-down list box, a page will display in that language with instructions as to how to get help enrolling in that threshold language.
There were a number of questions as well about what type of help functions would be available, in particular around explaining things like income, and actually we had a lot of questions about income. I do want to clarify that subsidies are available for people up to 400% of federal poverty level, and we also do enroll people here for people who are over that 400% mark, not to be confused that those folks would then not be receiving a subsidy, but they're certainly welcome to enroll for plans through Covered California. I'm going to ask Jerry to talk some about the various help functions to explain to consumers if they are coming in online, some of the explanations that they would need.
Sure. So there are a variety of help tools built into the site. One very prominent one, which is more educational, is the Learn Center that we took a look at during the demo, which has a variety of tutorials and fact sheets and frequently asked questions, etc. So a lot of rich information provided through that Learn Center, which through the search tool you can access information about whatever topic is of interest to you. In addition, there are help tools at various levels throughout the site. So first of all, always available through the header at the top of the page are help tools through other channels. So the phone number for customer service is listed. There's also online chat. And there's also a search tool to find help near you, meaning to find in-person assistance in your area of interest. So that's a search tool that brings up certified enrollment counselors or folks who are available for that purpose. There's also a general help feature there at the top of the page. And then on the page, you can see on this page there is a little blue eye icon at the top right corner, and that's generally available to provide specific information about that page. It's the page level help. And then in the application process on specific questions, there are little blue question mark icons that can be clicked to get field level help to explain the specific question that the person is on at that point in time. So there's site level help, there's page level help, and there's item level help to guide people through. And then there are also assistance tools like online chat and phone numbers, etc. So quite a variety of help tools that are built in. I did want to address one potential source of confusion around the subsidy amounts. I mentioned that help me decide tool, which is the fork in the road where people are deciding whether they want to apply for help paying for coverage. That help me decide tool I mentioned has a threshold, an income amount that's set at 420%. That's not because, that's to give a little bit of a cushion, if you will, to encourage people to apply, given that they're only providing very minimal amounts of information that may or may not be the precision that would be necessary for an eligibility determination. We wanted to build in a little bit of a cushion to encourage people to apply for help paying for coverage. That amount may change, but the concept is there that we're trying to help people get a sense of whether it's worth their time and effort to try.
So there's a question of what will happen if a submitted application's information is incomplete or problematic? What is the process for follow-up? So this will depend on whether your information is verified electronically. And for Medi-Cal, for example, if your income cannot be verified electronically, you will have to submit a pay stub and other things demonstrating your income. You will be able to do this online by uploading a scanned document to your application. In this case, either an eligibility worker or a customer service representative will look at your income and finish the application. If there are other elements that are missing and you've hit submit, there will either be, depending on what you may be eligible for, there will be follow-up by a customer service representative or a county eligibility worker to help you complete your application. Or if you're working in the community with an assister, your assister can help you complete your application if it's problematic.
Okay. Another set of questions is around how people are applying and putting in an individual application. They're doing this themselves online, as we said, that this was the method. There is a separate flow that would be conducted by assisters. And that term I'm going to talk about as an evolving term. Assisters now have been renamed by Covered California as certified enrollment counselors. So you may hear both terms. We are now calling assisters certified enrollment counselors. And that process, we have had a separate set of webinars for more information about how somebody becomes certified to become an enrollment counselor. I know there are a number of questions here about how that happens. Please look at the hbex.ca.gov website to see more about assisters. Also, agents and shops, same sort of information. We do specific webinars for those groups of folks because it's very specialized information on the Small Business Health Options Program, or SHOP. We will be having a webinar coming up in the next few weeks, so watch for that as well. And I'm hoping that some of you who are writing in questions here will be able to get your answers about that. Wanted to go back to a question that was regarding some of the verifications that happen. And many of you know that there is a verification process where the Calheers system will pay against the federal hub. And we're going to ask Ketcher from Accenture to talk about the federal hub verification process.
Sure, thanks, Julie. The federal government is in the process of building their automated system application that all the states will interface with. Several states, including California, have conducted initial tests with the federal hub, and our tests in California went well and were successful. However, as the federal government continues to refine the design of their system and continues to make progress in the build of their system, we will continue to work with them over the coming months to continue that testing to make sure everything is working as expected.
There are some questions coming in as well about how a person might interact if they do want to walk in and apply with somebody. Certainly the certified enrollment counselors are one method for that, and there will be certified enrollment counselors throughout the state for people to access, and that information will be available on the Covered California website when Calheers goes live. We also have the ability for folks to work with the local county Department of Social Services as a walk-in facility. And local counties, departments of social services will receive training as well in people who are applying for benefits through Covered California. So look for more information coming up on that. We'll give an update as well on the service center methods for applying at our board meeting this Thursday.
So there was a question about how is it that Pat is eligible for subsidies to purchase a qualified health plan, but her dependent child is eligible for Medi-Cal. So this is the way the eligibility rules will work, where you will have some parents who will be eligible for a subsidy in exchange, and their children eligible for Medi-Cal. That threshold is between 138% of poverty, which is where subsidies for qualified health plans in the exchange begin, and 250%, which is where eligibility for children in Medi-Cal ends. So in between those two brackets, 138% of poverty and 250%, the parent would be eligible for advanced premium tax credits in the exchange, and the kid would be in Medi-Cal.
Right. So in this scenario, Pat's income was 199% of poverty. So she was eligible for cost-sharing reductions in the premium tax credit, and her child, Jane, was eligible for Medi-Cal.
Okay, I wanted to give again the access to the HBEX website for information about assisters. It's hbex.ca.gov. So on that is the Health Benefit Exchange website. On that website, you can see postings of past and future webinars. And so any past webinars for the Assisters program will be recorded on that website. So those of you who are asking about how to find the past information, that's where you can go to look. And we'll continue to post, of course, the future webinars for the Assisters, now known as Certified Enrollment Counselors, SHOP, and agents. We have a number of questions regarding income levels. Certainly there's a lot of eligibility rules around this that will be the subject of training for the certified enrollment counselors, et cetera, but I wanted to ask Terry to just address income generally.
Sure. So the way the system is currently designed, as we saw, the person is asked to identify all of the members of their household, and there are questions that are asked for each member of the household in the household section, and then just those people who are applying in the applicant section. And those questions are all asked on a person-by-person basis. But once we get to the income section, income is asked on a household basis. So the questions are worded as, does anyone in your household have employment income or self-employment income, et cetera? And when the individual goes to add income, they're asked to identify who that income is for, and that's done through a drop-down menu that has all the members of the household in it. So that's the way that information about income is collected. right now. This is an area that we are exploring in the usability testing that's going on right now. So it's something that we're looking at and potentially will further refine, but right now that's how it works in the system today, so that the individual is prompted to ask about income for their entire household.
Okay, once again, the website, www.hbex.ca.gov is the website where you can find out about our webinars. And on the page that's displayed here on the webinar itself is a different website. It's actually coveredcalifornia.gov. And that is where you can submit questions if you have further questions.
So
That's the email address.
So there's a question asking, or some confusion around what the online application will be able to do regarding Medi-Cal starting in October. And this will be a full-service application in Medi-Cal, a single streamline application, which, as the example showed you, can determine eligibility for premium tax credits, cost-sharing reductions for a health plan exchange, and Medi-Cal eligibility. And you will, if you are eligible for Medi-Cal between October and December, you will receive actually through April, you'll receive a packet in the mail to enroll into your health plan. So full Medi-Cal functionality will be available to enroll into Medi-Cal, and then full functionality to enroll in Medi-Cal and your plan will be available in April. But just to confirm that applying for Medi-Cal and determining eligibility for Medi-Cal will be available on October 1st.
There were a couple of questions about the relevance of UX 2014 in the design. Terry, would you?
Sure. I'd be happy to discuss that. For folks who aren't familiar, Enroll UX 2014 was a project sponsored by a number of healthcare philanthropies that provided a model for a single streamlined application and enrollment process. Still available at ux2014.org. And that model is something that we looked at and leveraged for the purposes of this design. You can see many common elements in the design. Among the things that were leveraged from there were things such as the introductions to each section that provided an overview of what to expect, what kinds of documents you might need, and the amount of time to complete. Those road markers along the way were drawn from Enroll UX 2014. Other elements included things like the Help Me Decide tool that is featured in the CMS application draft, but it's also something that was present in the Enroll UX 2014 project. The general layout of the plan selection process, where the person is first asked about some things that matter to them and then shown an array of plans organized in a column-by-column approach, also came from Enroll UX 2014. So there are a number of ways in which the materials from that project were leveraged for this design. And I will note that California had a team of folks that participated in that project, and they were very actively engaged. And so a lot of the concepts in Enroll UX 2014 actually were developed by folks in California and have now been carried through.
I want to check and see if there are any questions that we need to address by phone. Anything that is coming in?
Yeah, hands up about 20 of them.
Okay, so we're looking at the list of folks that are calling in, see if there's anybody out there with a phone question. going to the phone of Kevin Blaine. Kevin, are you still on, and do you have a question?
Yes, I do. Thank you very much. Can you guys hear me?
Yes,
Yeah.
we can hear you.
Okay, excellent. Thank you. Great presentation so far this morning. Quick question for you. My company, we predominantly sell to small businesses, and what we understand is if you have actually a large business, over 50 employees, and you offer a qualified and an affordable plan, the family of that employee will not be able to go in and get a subsidy that is going to plan. Where in here will the calculator or with the eligibility screen for your spouse working for a company that offers a qualified and affordable plan?
Hi, Kevin. This is Terry Shaw. Thanks for the question. We went through the process pretty quickly, so we didn't linger on each and every question that's in there. But there is a set of questions, especially in the applicant's portion of the application, that asks about whether their person has other coverage or has access to other coverage. And if they indicate yes, then information about that other coverage is gathered. And so that's the process by which we identify if somebody does have other coverage that would disqualify them from premium tax credit or cost sharing reductions. I would note that would not disqualify them from purchasing coverage through Covered California without subsidies, nor would it disqualify them from Medi-Cal if they're otherwise eligible. But we do ask those questions in order to be able to determine eligibility accurately.
Excellent. Thank you very much.
Okay, let's go to another caller. B.R. Jackson, do you have a question for us today? We're moving on to see if Rosa Lee is still with us on the phone for a question. Rosa? Okay, let me take, while we're going to another caller, let me take a couple of other questions again about the website. We have two websites, and I think there's maybe some confusion about that. So one website is hbex.ca.gov. That's HB as in boy, x.ca.gov. And that is where you can find the webinar postings and information about applying to be a certified enrollment counselor and things of that nature. The other website is an informational website, coveredca.com. That's coveredca.com. So you can find us under both places, or if you go out and Google Health Benefit Exchange, it will usually lead you to the HBEX website. And I know our technical support folks are trying to answer some of those questions that are coming in about websites, but I wanted to address them globally because we continue to get questions. Where can you find the repeat of this webinar? It is on hbex.ca.gov. So that will be posted within the next day or so. We did record this webinar, and it will be posted out there. And you can also find postings of past webinars on a number of subjects from Covered California. Okay, with that, I think that concludes the time that we had allotted. Thank you very much for all of your interest, and we look forward to bringing you further updates from Covered California. Thanks.